On this research review, we're going to look at a paper that looked at the comparison of instrument-assisted soft tissue mobilization and extracorporeal shockwave therapy on lateral elbow pain or lateral epicondylitis. Anybody who's dealt with it personally knows how frustrating this is. Anybody who's treated it understands how frustrating this injury can be. And so this is one that caught my eye because both very common treatment modalities, probably instrument assisted or IASTM, being more common just due to its convenience and affordability, whereas extracorporeal shockwave therapy is gaining traction but is not cheap, and we'll talk about that in a little bit. But essentially what this paper looked at is pain rating, grip strength, and just general overall function rating of the person before, after, and again later after treatment. It was a single-blinded clinical trial, had 48 people, had 3 groups, so it was the IASTM group, the ESTW group, and then a control group, which basically was a home exercise program and stretching. For the treatment groups, they ultimately got 8 sessions with a home exercise program, and those were 2 treatments a week for 4 weeks for those 8 sessions. So how they did those sessions for the ESTW, or the shockwave therapy, it was 2,000 shocks at 10 hertz and 2.5 bars, which ended up lasting about 3 or 4 minutes. The IASTM group was for 90 seconds, focusing on working in all directions along that tissue, superior, inferior, diagonal, medial, lateral, at a 30 to 60 degree angle. And again, those were for 2 times a week for 4 weeks, plus that control. And so they used the visual analog scale to assess pain, again, before, immediately after, and then again after. They used a handheld dynamometer to test grip strength, and then they used the patient-rated tennis elbow evaluation, again, to look at general function of the elbow at baseline, post-intervention, and 4 weeks after that. It was interesting what the results came out with. I've heard a lot of great things about the shockwave therapy. This is the next thing. But the ISTM did really good. So they found that overall, for pain, the instrument-assisted soft tissue mobilization was the best overall, but that shockwave was better than the control. When it looked at for the patient rating tennis elbow, it found that the instrument-assisted soft tissue mobilization was the best one, even compared to shockwave therapy in terms of improving those outcomes. And then ultimately it found that instrument-assisted soft tissue mobilization resulted in better outcomes for grip strength as well. So ultimately that tells you that both have an option to be good. Both can be helpful, but it seems like in this case, instrument-assisted soft tissue mobilization was the best treatment for lateral elbow pain in this specific study. Again, they didn't do this on athletes or anybody hyper specific. It was 48 kind of gen pop people, but it is something that, again, when we talk about evidence-based practice versus evidence kind of guided practice, we're taking into account that maybe just sticking with some of these basics could really get you the outcomes that you're looking for, and that is important. And some of the things to go along with that, some of this is anecdotal. I tried to look it up as much as I could, but shockwave treatment therapies, I believe, aren't fully covered under insurance. Obviously, there's some nuance to that. Some places might, some places might not. But a lot of them are a cash pay, and I know in a system I used to work with that was $175 per treatment. So you're talking a 3 to 4 minute treatment for $175, which can be hard to stomach, understandably, for some people. And it ranged anywhere from $100 to $500 per treatment. And so if you don't have that kind of free money hanging around, it might not be a great option for you. That being said, with instrument-assisted soft tissue mobilization, I would recommend, if you're, someone who isn't a clinician who's listening to this, I would talk to somebody who's got experience, has done some training, has some hours, practiced with this, because they can bring a ton of extra benefit with that experience. But this is potentially, if you do a little searching, something you could attempt on your own. The some is good, more is not better definitely falls into this category. So, not overkilling it and potentially causing more infliction there, which is, again, why you should go with a practitioner with this to hopefully maximize your outcomes. But I think that's definitely something worth looking at because it is so much more cost effective potentially than the shockwave therapy. And so for clinicians out there, maybe you don't need that next fanciest thing specifically for this lateral elbow pain condition. That the kind of the basics may be all you truly need for that. And so really interesting study. We'll link to the actual study in the notes so you can take a look at it, read through it if you want, have it for your own reference. But sometimes the simple thing can cause the most, and in this case, it at least gives a good sign that could really be effective. So that is this research review, and we'll get going with more of these as we keep finding interesting articles that we think you can apply to both your own health and also for clinicians to your clinical care. So we'll catch you with the next one.